My name is Dr. Arlene Chung, and I am the Residency Program Director for the Emergency Medicine Residency Program at Maimonides Medical Center. The program is a 3-year program based in the heart of Brooklyn, New York. We have 18 residents per year for a total of 54 residents. The emergency department at Maimonides Medical Center sees about 120,000 patients each year. We are a level 1 trauma center. We are a level 2 pediatric trauma center and the only pediatric trauma center in the borough of Brooklyn. We're also a stroke center, a STEMI center. We've been top 10 in the country for a number of important measures like myocardial infarction, CHF, pneumonia for the past 3 years running.
Maimonides is the biggest hospital in the biggest borough in the biggest city in the country. We have a faculty of over 60 attending physicians, the majority of whom actually are subspecialty trained, able to provide advanced training in every aspect of emergency medicine possible. We're in what is a very education-centered, cutting-edge clinical environment where people really care about resident education and prioritize that above almost everything else in what we do.
Maimonides is a very busy and interesting emergency room. If you Google busy ER, Maimonides is actually one of the pictures that will pop up.
Being in the heart of Brooklyn, in pretty much one of the most diverse cities in the world, I think you get the opportunity to care for patients from really all varieties of backgrounds, speaking all varieties of languages, while at the same time providing really first-rate medical care is really a unique and humbling challenge.
I think Maimonides is maybe the second most diverse zip code in all of the country. And so I don't think you can really recreate that.
I feel like the patient volume is amazing for our training. Learning how to juggle all of this volume and all of these really sick people has been really awesome in terms of training.
Alongside the emergency department and critical care exposure, we've got wonderful complementary programs like ultrasound. Our residents boast that they do more ultrasounds than every other resident in the entire country, so that's one of our true strengths.
We take a very focused approach that first year on emergency department fundamentals, ensuring that the residents have a broad experience to a large variety of clinical presentations. The second year is primarily focused on resuscitation and critical care. It's really the centerpiece of the program. And the third year is about putting those things together to create a senior resident who comes out clinically strong, able to care for every condition in an efficient way that will serve them very well in their careers to come.
I wanted an experience that was going to be a little bit more intense, high patient volume, really diverse, and I wanted it to be kind of hard, but really soulful and like loving and family-oriented program, and I kind of found that home here.
There's a lot of special things about Maimonides, but I think the most special is how close-knit everybody is, and it's not just between the residents, it's also between the residents and the attendings.
So residency so far has been an incredible experience. Of course, it comes with its struggles, but throughout this process, my co-residents had my back, my attendings had my back, and I think I am a much stronger doctor today.
Clinical training at Maimonides is top-notch. All of the supporting educational activities are wonderful. But the thing that really ties us together are the people. Each and every physician, nurse, tech contributes to this really beautiful culture, and it really does feel like a family.
The interactions between the residents and the attendings here are really great, and they're really interested in getting to know you and getting to know your background and what your interests are. I feel bad sometimes when I talk about my residency with my friends at other hospitals, and they're just like, residency's so hard and I feel so tired all the time. I'm just like, okay, well, I love my program.
Our residents receive robust training in critical care, in ultrasound, and pre-hospital medicine, as well as focuses in pain medicine and addiction and toxicology, and a variety of other really cutting-edge pathways that are shaping the way emergency medicine is being practiced today and in the future.